Well, it's time once again to join the Minister for Health and Social Care, David Ashford, who's doing this, as we were saying in the last part, hopefully for the last time remotely. We're going to try and maybe keep the question sessions going, but hopefully in person. So we'll see. When the questions stop, we can stop. But Mr. Ashford, here we go. And a lot of these will be about vaccines. I've sort of condensed quite a few because I think you probably have that, you know where we're going to go on this one. My husband and I are both in our 40s, registered to have a vaccine, but decided to have the declined to have the AstraZeneca. I cancelled mine last week. He cancelled his today, not on the same day. We were both told we would go to the end of the list for declining, which is understandable. However, we've both been told it's unlikely we'll be offered any alternative. And really, this and other ones are going about, why can't they have some option when they're so worried about that particular vaccine?
Well, firstly, there is not a reason for people to be worried about AstraZeneca in this way. I've laid out before that the risks from COVID are a lot higher than the risks from the vaccination. The odds in terms of the CSVT blood clots, which is what people seem to be concerned about, is 4 in a million. So 1 in every 250,000. That is actually much less of a risk than the risk of getting COVID that causes these type of blood clots. And in fact, the vaccinated population is not seeing any higher risk of CSVT than the unvaccinated population, because you expect there to be roughly each year between 3 and 6 cases per million in an unvaccinated population. There's less risk than there is off the contraceptive pill. From these type of blood clots, and also less chance than you would get them from a long haul flight. So it is disappointing if people are switching, but people can't pick and choose which vaccine because it depends upon supply. We can't guarantee that if someone re-registered in 2 months' time, they won't simply be offered the AstraZeneca vaccine again. There is risks with anything that we do around vaccines or anything else. There's risks with the Pfizer vaccine. There's risks if we get Moderna on Ireland. But what we have to say is those risks are exceptionally small.
And we keep talking about the mix and match scenario, but I mean, the data keeps coming along and it's looking promising, but that isn't on your system at all to have, a second dose of something else if necessary.
No, that would depend upon those clinical trials. The clinical trials are still ongoing. There's been no clinical trial that's reported in relation to that. We always make sure, because we have to remember vaccination is a medical treatment at the end of the day. So we have to follow the strict safety protocols, and the protocols in place at the moment are that you should have the second dose of the same vaccine that you had first.
Okay. The first uptake percentage is projected to finish the vaccinations when, and what is it based on? So when will that come to an end? And when we move to migration, how will it affect particularly school children, the damage for education and children's social skills? Please distinguish also between primary and secondary schools. I'm not sure if that's right in your area, but do you want to go?
Well, I'm happy to give it a go as always, Paul. In terms of vaccination, we expect the adult population to have all had their first dose by around about mid-May, which is on course for what we said throughout. In terms of children's education is exceptionally important. We have been luckier than the UK because we did have all those months of normality when the UK didn't, where we managed to keep children's education going, and it's only very recently that it's been massively impacted, where we even had to shut the hub schools. But it is important both at primary and secondary we get back to normal, because actually the cohort that will probably be most affected is one we don't tend to speak about, which is those that are transferring from primary into secondary. It's quite a big jump going from primary school to secondary school, and there's a cohort of about 1.5 years there that haven't had that sort of proper transition. So it's important that we do get things back to normal and we play catch up with the children as much as possible.
Can you ask about the 2 vaccine incidents that were reported? Have they been reported to the yellow card system for recording the adverse effects?
Yes, we use the yellow card system, so people can log on and report them themselves. But we also, if we become aware of anything, use the MHRA yellow card system and we report as well.
And I need to just get some more clarification. You held your hands up. There was a bit of a cock-up on that data being given over to the public because there was a bit of a scare in there initially. What happened? What went wrong?
Well, I was informed about both cases simultaneously, and I read it as being the same case. So it's entirely my fault. I hold my hands up to that. I read it as being the same case, that someone had anaphylaxia, and then I was informed that a patient had died shortly after having had the vaccine. It goes to show you should never assume anything. So I took it as being the same case. It turned out it wasn't. There were two separate cases. The one with anaphylaxia was absolutely fine, which is great to hear. They recovered. The person who died shortly afterwards, there was investigations ongoing, and I was informed late that afternoon of the sitting of the House of Keys that the investigations had literally just concluded, and that it turned out it was their underlying health conditions, not actually the vaccine, that had killed them. And I need to be absolutely clear, I did, because my remarks and keys, if people go back and actually listen, and the wonderful thing with us having a Hansard, I did actually state quite clearly, even although I got the two convoluted, I did make quite clear, my second sentence was, just because something occurs after vaccination, we shouldn't automatically link it back to vaccines. So even if someone should tragically die shortly after having had a vaccine, we shouldn't automatically assume the vaccine is the cause, because people do get naturally ill even after they've been vaccinated. And as it turned out later that afternoon, I was proven correct on that, and it had been stated that there wasn't a link.
And we're disappointed with it was actually UK outlets, media outlets, who went with screaming headlines about that initially and made a link that wasn't there.
Well, people will make a link. It's a natural sort of thing for people to jump to conclusions. It's disappointing if that was the way it was reported, because I was quite clear in the House of Keys that I didn't state there was a link. I said there was an incident. Someone died shortly after having had the vaccine, which I was, perfectly honest with Mrs. Kane in the answer to her question. But it turned out, thankfully, there wasn't a link between that. And we do need to recognise that people will naturally get ill after they've had vaccine. It doesn't mean it's necessarily the vaccine that's caused it.
My next question is back to the dying from or of COVID, basically. Are those figures up to date, or how do you deal with them nowadays?
Yeah, so we are going through and splitting everything out. There is a difference, of course, dying with COVID and dying of COVID. You can have people who have COVID but then die of a different condition. So it is important for transparency we do that. I think the work's still underway to split that out. I'm not sure if they've actually managed to do that on the dashboard yet, but we will be doing it for transparency purposes. And
I think the last one, I have a question about the current quarantine period on return to the island. Other than Hong Kong, the Isle of Man appears to be the only country insisting on the 3-week quarantine. I mean, we come up with this one every week. Any more news that can help these people because they want to meet up with family and friends?
Yeah, again, it's very frustrating for a lot of people, but we've been proven right on the 21 days, to be honest, because we've seen with the Kent variant people testing positive on their day 13 tests, people testing positive later in the cycle. So where people haven't been willing to do the 3 tests or not paid for the 3 tests, then I think we have been proved correct to do the 21 days. It's kept our island safe while we roll out the vaccine programme. And we said, we did a long interview on this, Paul, in between the 2 lockdowns, where we said we needed to buy time with our community to get the vaccination rolled out. That's exactly what we've been doing. As we move into the mitigation phase, then we will need to look at quarantine times. We recognise, particularly when we move to friends and family, being able to come over to the island. It's not practical for them to quarantine for 2-3 weeks before they can actually go and see their friend or family. So we do have to look at that, and that will be part of our gradual phase return to normal.
And what do you make to the data in the UK, those rapid tests, especially they supplying them now? There's a very bad hit rate now. I mean, you've always said that's why you weren't bringing it in here, but is that it then? No chance of rapid tests coming in here? So
we're talking about lateral flow testing. As we've always said, it's very hit and miss. There's been some recent reports we've seen in the UK media where the technology is improving. We've got to be fair in that they are becoming less hit and miss than they probably were at the start of the outbreak. But lateral flow is very good at a sort of mitigation stage of just doing a point in time test, but it shouldn't be used to try and make decisions and say, if you come back negative, you haven't got the virus. because that, like I say, that you can't make decisions off the back of that. And also, what they've been intended to be used for in the UK is they're rolling out household testing, where people can test themselves. As the Director of Public Health has said publicly on many occasions, you have people who may not, the people who you want to take the test may not, for various reasons, be the people who actually do.
Okay, well, thank you again for your time. Next week, with more questions, maybe certainly an interview, do send them in to me here, news@banks.net. And we have an appointment on the Monday, hopefully. I think it's in our diaries, regular, right, for the moment?
It is, and we'll be meeting up in person, Paul. No more reliant on the technology of Skype.
I have to say, as always, you're very good at getting my Skype working when there's an upgrade issue. But okay, we'll see you again next week. Thanks for your time.
Thanks, Paul.